Hi, this is Cindy Raymond, and this is my article analysis on who receives speech language services by 5 years of age in the United States by Morgan et al. ECED 5356. The purpose of this research article was to identify factors that determine which children are most likely to receive speech and language services in the United States by the age of 5. The research analyzed two questions related to speech and language pathology. The first question is, to what extent do early expressive vocabulary delays increase the likelihood of receiving speech and language services? And secondly, are children who are minorities less likely to receive speech and language services than white children who are otherwise similar in their background characteristics? The methodology used for this research was a mixed method approach. First, the researchers conducted a secondary data analysis of the Early Childhood Longitudinal Study birth cohort. This is a nationally representative data set that's maintained by the Department of Education's National Center for Education Statistics. The data set for this includes birth certificate information, as well as direct and indirect assessments of children's cognitive, academic, behavioral, and physical functioning at 9 months, 24 months, and 40 months of age. Parents were also interviewed during these checkpoint times of 9, 24, and 48 months of age of their children. And then they were also surveyed about who was identified as receiving speech services. So the findings of this research shows that the data identified a relative consistent set of predictors of the receipt of speech and language services. So early onset of vocabulary delays were very strong predictors of speech services for children. Although having expressive vocabulary delays at 48 and 60 months of age increased the risk of services, the strongest predictor, interestingly, was getting speech services was due to having expressive vocabulary delays at the age of 24 months of age. There were also repeated findings that Black and Hispanic children that have a language other than English are also less likely than otherwise similar white children to receive speech and language services. Being born with a very low birth weight was also a consistent factor in receiving services. Additionally, there were more intermittent risk factors of getting speech services that included maternal depression, a family history of learning disabilities, a prior history of externalizing behavior problems, and a moderately low birth weight. They just weren't as prominent as the risk factors listed above. So the implications of this is that having a smaller expressive vocabulary at the age of 24 months actually increases children's risk for lower academic achievement and behavioral functioning by kindergarten entry. With this information, the importance of early screening at 2 years of age and intervention efforts by speech-language pathologists are imperative. There is also implications for policy and practice with this study. For example, speech-language pathologists and other community members working with young children, such as pediatricians and caregivers, may need to increase their monitoring efforts to ensure that cultural and linguistic factors are not interfering with the ability of families and minorities' access to speech and language services. Speech-language pathologists and educators may also need to increase efforts in communicating with minority communities and providing more information to them about language development, the availability of services, and the importance of early intervention. This also shows the need for speech and language assessments that are culturally and linguistically appropriate for children from diverse backgrounds. Some directions for future research. I believe that this research lays the foundation for continued relevant research on early intervention services in speech and language on children before age 5. Some future research proposals might include looking at children in low socioeconomic households. This was one of the questions I had related to this article that I'll discuss a little bit further in my reflections. But future research might also look at who makes the majority of referrals for early intervention so that we can pinpoint where the gaps are in making these referrals by age 2 so that children receive the much needed services before school entry. For examples, does the majority of referrals come from child care or school-based programs versus the child's pediatricians? If we know that the expressive vocabulary delays are predictive of speech and language services, what are we doing to ensure children are screened for these delays in a timely manner? That's an important question. So the application of these research findings, as an early childhood professional working with Head Start teachers and the SLPs in my school system, this research backs our approach to giving children a very rich oral language environment and conducting early screeners to assess for young children that may need speech and language evaluations. As a result of the research findings on children from non-English speaking homes and children of color, I want to ensure that teachers and speech and language pathologists, or SLPs, I work with are given professional development strategies to effectively reach out to these families of diverse backgrounds and on the process of identifying children with speech language impairments. I want to advocate for early intervention for every child if needed. A couple of things I plan to implement due to this information from the article include ensuring the teachers I work with are knowledgeable and understanding the importance of early intervention services and providing professional development on the importance of reaching out to families of diverse backgrounds and on the process of identifying children with speech language impairments to ensure that the cultural and linguistic factors are not, in fact, interfering with minority families receiving services. Some of the reflections from my research article include wondering why so many children in our area receive speech and language services before kindergarten entry. I know that about 17% of our enrollment of 148 children in Head Start receive speech services, and mostly for articulation disorders. I actually chose this article in hopes of gaining some insight on why speech language IEPs are so prevalent among young children under the age of 5. Although this article did not really answer those questions directly, there were some helpful information pointing me towards who is predictive of getting services before reaching kindergarten age. I really wasn't surprised to see that the data of this research showed that an expressive vocabulary delay at age 2 was the biggest predictor to receiving speech and language services, although I did find it very interesting that if the delay was seen at 2, that it was a stronger predictor of any other age that was looked at during this study. I think this resonates soundly with the research on the 30 million word gap by age 3 that was conducted by Betty Hart and Todd Risley. Their longitudinal studies with families from differing socioeconomic levels showed the importance of the early years in language acquisition. An average child in a welfare family will accumulate roughly 32 million words less than a child born into professional families. As I analyzed this research, I often wondered if this is why so many children enrolled in Head Start are in need of speech services. I think there may be a direct correlation between the vocabulary gaps and speech services of those families who are in poverty, of those children born into families of poverty. I've also noted how my research article supports the study cited in our text, Literacy Development in Early Childhood, stating the importance of oral language development to later development of academic skills. The ability to use language to communicate affects children's learning and social cultural interactions. But my biggest takeaway from the research article is that with the strongest predictor of speech language services being children with small expressive vocabularies at the age of 2, there should be a heightened importance to immersing young children in oral language and the need for early assessment of expressive vocabulary at 24 months of age in school-based programs and pediatrician offices. I also reflected on the disparities among minorities receiving services compared to similar white English-speaking children. I know that within my school system, having a culturally unbiased assessment is not always easy, especially with the early childhood assessments. This is why I chose one of my implementation steps as working with the professionals within my organization to provide professional development on reaching out to diverse families and ensuring that language and culture are not barriers to early intervention services. I also questioned how many children in the study were receiving speech language services for articulation delays versus actual language delays, and I wonder, would that make a difference? This study speaks mostly of expressive vocabulary shortage, but it does not talk about the pronunciation or articulation delays of children who may be enrolled in speech therapy. Lastly, I would like to find out exactly what factors play a role in less children of color receiving services than similar white children. Is it the lack of professional access? The research does not elaborate on this factor, but I would like to know more so that we can be more informed as professionals and make the necessary steps to close the gap in the disparity of speech and language services. I would like your thoughts and your questions. What are your thoughts on who is receiving speech and language services before officially entering school? Were you surprised by any of the information that was presented from this research? Why? Or why weren't you? If you do work for a Head Start or other school-based program, do you have many children that receive speech and language services? Do you think that delays in articulating or pronouncing words sets a child at a disadvantage when it comes to his or her academics? Or do you think most disadvantages a child has in receiving speech and language services are due to expressive language delays? And finally, maybe you might think about how this information correlates with your studies on oral language development of young children. I look forward to hearing your thoughts, hearing some of your reflections, and definitely engaging in some conversation and questions on my research study. Here are the references, and thank you for listening.